Hello, everybody. My name is Naren Nayak, and on behalf of Bitwise Academy, I'd like to welcome you all to this webinar titled My Journey in Medicine. And our speaker for today is Dr. Nitya Rajeshuni. She is a physician at the Stanford Hospital, and she has uh, accomplished a lot in her career already, and she's here to share her journey for those who are interested in pursuing or considering the pre-med track in college and beyond. With that, let me welcome Dr. Nitya Rajeshuni. Over to you, Nitya.
Great. Thank you so much, Nadine. I'm really excited to be here today to speak to all of you and share a little bit about my journey in medicine, as well as sort of a high-level overview of what it's like to pursue a career in medicine as a healthcare provider. So I'm going to take a second to just share my screen and get my PowerPoint up and running, and then we will get started. Great. All right. Can everybody see my screen okay?
Your screen is visible, Nitya.
Perfect. Okay. So just need to get my presentation started. Okay, and we will get going. All right, well, everyone, I'm really excited to be here to speak with you all today. And as Noreen referenced, this talk is really about my personal journey in medicine, which I'm hoping to use as a lens for the students and the parents in the audience who are thinking about potential careers in healthcare and what that might look like. So briefly to cover an agenda, just to give you a sense of what we're going to be talking about together today, I will spend about the first half of the talk or so focusing on my personal journey in medicine. So not just the steps that I had to go through to become a doctor, but also my key areas of interest and formative experiences that I've had along the way. I'll then spend the second half doing more of a high-level overview, going through topics like what does it take to become a physician, career paths within healthcare, from being a healthcare provider to other paths beyond that, which are things we don't always think. So as I was saying, I will spend the second half of the talk focusing on topics like what does it actually take to become a physician? We'll review career paths within healthcare, so everything from being a healthcare provider to other paths that have nothing to do with being a healthcare provider, but still are meaningful ways of contributing to healthcare. We'll go through the pros and cons of a career in medicine, the future of medicine, and then finally save some time at the end for some Q&A. So to start out, what I'd like to do is give you a high-level overview of who I am and the different chapters that I've gone through in my life to date. So currently, I am a physician and faculty at Stanford University in the Department of Pediatrics. I'm also a faculty member with the Center for Asian Health Research and Education, or Stanford Care, the Center for Innovation in Global Health, and the Maternal and Child Health Research Institute. Now, I'm relatively early in my career. I just started at Stanford about 6 months ago. So prior to this, I was still in training. I was an innovation fellow at Harvard Health Tech, which is a program based out of Harvard Medical School, which I will talk a little bit more about later in this presentation. Prior to that, I was a pediatrics resident and trainee at UPenn at the Children's Hospital of Philadelphia. And before that, I was a student and I did the vast majority of my training at Stanford. I did medical school as well as a master's in epidemiology and clinical research. And then I also obtained my bachelor's in biology. And on the right, I have a picture of myself from my white coat ceremony, which for those of you who might not be familiar, it's a major milestone in medical school that every medical student goes through at the start of their chapter. And it's the first time that you're gifted your white coat and often your stethoscope and some additional tools that come with it. So I'm guessing that a big question that is bringing a lot of you here today is this idea of why even pursue a career in medicine? But my advice to students and families always is first and foremost, before you even start to think about how to get into medical school or how to make a career in medicine happen, which is where many families jump to immediately, it's really, really important to think about this question of why medicine and whether or not it's a path that aligns with your values and what makes you you, because it is a very long and a very arduous path, and it's important to understand what it takes to get through it and whether or not it's going to be a meaningful path. And I think the best way for me to be able to share this with all of you and articulate why medicine in many ways was a good fit for me, what I'd like to do is really start at the beginning and tell you a little bit more about me and my story from a personal lens and what makes me me and the things that I care about. So, what better place to start than the beginning? So these are a couple photos from my childhood. So on the left, as you can see, I clearly had an inclination towards medicine from a very young age. The interesting thing, though, is that in the South Asian community, as many of us might know already, it's very common that families want their children to go into medicine. And the irony is that I come from a family of engineers, so still a lot of STEM folks in my family, but my parents actually were not really the kind to try to push me into medicine. In fact, I was the one who really wanted to go into medicine. And it started with this enamorment that I had with my own childhood pediatrician, Dr. Ann's. And most kids hate going to the pediatrician because, usually you associate going to the doctor's office with having to get shots or get poked and prodded, and it's not a fun experience. But I, for some reason, loved going to see the pediatrician. And one day my mom asked me, why is it that you love going to Dr. Ann so much? You literally look forward to these appointments every year. And I looked at my mom and I said, well, Mom, Dr. Ann's makes people feel better. Like, why wouldn't I like that? Why wouldn't I want to be like her? And that was where the seed was planted. Now, I want to take a moment to share one of my favorite quotes. Language, identity, place, home, these are all of a piece, just different elements of belonging and not belonging. So this is a quote by Jhumpa Lahiri, whom some of you might be familiar with. She's the author of The Namesake, which is a novel about Indian American identity. And I bring up this point and this quote here because this theme of being a hyphenated, as being someone of a hyphenated identity, so being Indian American, is a theme that has stuck with me throughout my entire life, but not just has shaped me personally, but truly has shaped a lot of what I have chosen to do in my education and my career to date as well. So these are photos of me as a child in India and with some of our cousins and family members, my grandparents. And I was very lucky. My parents took me to India quite frequently growing up so that I had the chance to get to know my family and form a connection with the country that I came from. And on my dad's side, my dad grew up in poverty, and I have had many family members who have passed away from cardiovascular disease or infectious disease. So this idea and this desire of wanting to help communities beyond just the local community that I grew up in was planted very, very early. Similar to my hyphenated identity as an Indian American, another way in which I consider myself hyphenated is that I both love the sciences and STEM fields as well as the arts. And this has been a theme in my life pretty much from the time that I was a child. So on the left, you can see a photo of me here at my 8th grade science fair. And then on the right, you see a photo of me as a senior in high school playing the lead in The Music Man, which is a musical theater show. And trying to find ways to bridge the critical thinking and the analytical thinking of science with the creativity and the humanism of the arts is a theme that I have been pretty much trying to chase my whole life. And it's manifested in ways both in terms of how I balance work with my hobbies and my other interests, but also in terms of my work itself, trying to make choices that allow me to bring creativity and humanism into science and into medicine. So with that, I'll circle back to the why medicine question. So you've learned a little bit about some of the things that make me me, and we'll spend more time going through some of the key experiences that I've had. But I'd like to distill this down into a few general themes that still apply to many people who choose a career path in medicine. And the first is this idea that, medicine is one of those few careers that really is centered around a principle of service, so directly impacting people one-on-one. Every day that you see a patient is a day that you get to help someone. And for me personally, I've had an interest in working with underserved communities and vulnerable populations locally and abroad for a long time. So medicine was a good fit for that reason. Next, medicine is also one of those few fields that I think really does strike a beautiful balance between being a science and an art. And when I say an art, I mean that there are opportunities to bring in creativity and true art, such as physicians that choose to engage in the medical humanities, but also that it is an art in the sense that it is, it involves dealing with human beings. It's a human-facing career at the end of the day. And having that spirit of humanism is extremely important to becoming a great physician. And obviously, research and scientific discovery are a big part of what it means to be in medicine as well. And then finally, this is the third category that I don't think people talk about enough, and I will definitely explore this more in my talk today because I think it's an area that we need to talk about more, and it's an area that I care about personally quite a bit. And it's this concept of what it means to be the MD plus physician. And by that, we'll talk about this more later, but by that, what I mean is that, I think for many, many decades, we've had a very traditional notion of what it means to be a physician. But the reality is that to be a physician, that doesn't mean you have to spend all your time only seeing patients. There can be opportunities for innovation and creativity, wanting to make a systems level impact beyond the direct impact that you make one-on-one for your patients. There are opportunities for interdisciplinary work, as well as for bridging the gap between academia and the community and industry, which historically there has been a big divide and still is, but there are trends in a new direction, and these things are shifting. So I think it's important as a young student or as parents that are guiding and coaching your children to remember that what it means to be a physician today is very different from what it meant 20 years ago, which is very different from what it'll mean 20 years from now. So with that, what I'd like to transition to doing now is talking a bit more about some of my key experiences in medicine. And in an ideal world, if we had infinite time, I would go chronologically through all of the different chapters that I've been in and talk you through all of the cool things that I've gotten to do. But because we don't have that time today, what I've done is pulled key experiences across the years and across my different educational chapters, whether that's undergrad, medical school, or residency, or fellowship. And I've lumped them into categories around some of the themes that I care about, because those themes play a big role in what I do as an academic physician today. And we'll talk more about what it means to be an academic physician later in this talk. So the first key theme for me is health equity, which for those of you who have not heard of the term, is very different from a concept of equality. Equity operates on the principle that not everybody is born into the same circumstances, but everybody has the same right to healthcare access and to healthcare resources more broadly. So that means that we need to come up with solutions and interventions that cater to different people and populations where they are. Working in an urban setting is very different from working in a rural setting. Working in a low resource setting in a developing country is very different from living in Palo Alto in California. So it's important to think about the communities that we work with and what communities individually need. Now, to give you a sense of where I developed this interest and how it's played out in my life, interestingly, my interest in health equity didn't start so much around health, but just more broadly around what it means to even have equity to begin with. So as a college student, even though I knew I was interested in going to medical school, I spent a lot of time and work doing things that involved education. And for me, I knew I was interested in working with kids and families in the long run. So naturally, I think education it made a lot of sense why I was interested. So a few of the key activities that I did as an undergraduate student at Stanford involved teaching reading and writing in East Palo Alto, which for those of you who aren't from the area, is very different from the Palo Alto we typically think of near Stanford and is a lower income underserved community. I also spent several years directing an educational nonprofit called Splash, which was based at Stanford. And I not only directed that team for several years, but was a teacher as well. And so what we did was run these large-scale biannual educational events for middle and high schoolers, where we would bring students to campus twice a year, and usually over 1,000 students. And we would organize classes taught by undergrads and Stanford grad students for these students. And during that time, we also, like a big goal for us was actually increasing the percentage of students that we reached that were from underserved communities and having financial subsidies to help them be able to engage in this experience. I also started developing an interest in technology and education. So I spent a good portion of my time designing digital health curricula for local school systems as well. Another way that health equity has played out in my education and career is research. So in medical school, I spent an additional year, so 5 years total, getting my MD as well as a master's in epidemiology and clinical research. But what I've done is use that skill set, but really apply it more so for health services research. So while I consider my skill set to be epi in origin or epidemiology in origin, I very much consider myself a health services researcher. And a lot of the research that I've done has revolved around health disparities, healthcare access, and healthcare utilization, and thinking about how outcomes vary by racial, ethnic status, by socioeconomic status, and then also thinking about what it's like to have healthcare in the US versus in a country like India, which is a low and middle income country. Another key experience I had in college was more from the policy lens, where I had the opportunity to do an internship at the NIH in the National Institute of Allergy and Infectious Diseases in the Office of Global Research, where I worked as a research assistant and then also did some programming around distance learning and global health. So again, another seed was planted around this intersection between technology, health equity, and particularly global health. And this was through a program called Stanford in Washington, which for us was similar to an abroad program. I spent a whole term in DC working full-time at the NIH and then taking classes on the side. And it was an amazing introduction to health policy, which actually intersects nicely with a lot of the health services research that I do as well. Next, I've already started to talk about this a little bit, but I'm going to spend a little bit of time talking about some of my key experiences in global health and where that interest came from. So as an undergraduate student, as I mentioned, I was more interested in health equity, and that started with more of a local interest within the States. But gradually that interest expanded to wanting to contribute to communities outside of the US. So in college, I had this amazing opportunity to participate in a program called the Senior Reflection at Stanford, which is essentially the equivalent of a creative honors thesis. So it was geared towards students that wanted to bridge the gap between the arts and the sciences. And what I did was draft, choreograph, and direct an Indian classical arts collaborative on special needs in India. And this was based on the experiences of my own cousin in India who has special needs in her family. And I spent a year first going through interviews with them and learning about their experience. I then took that data and worked with musicians on campus to create original music, original dance, original lyrics. I recruited dancers and directed the whole show myself. And we put on the show at the end of the year for both the Stanford community and the local community. And that was a really powerful experience for me and showed me that, art as advocacy and finding ways to keep art and creativity in my life and in my career was going to be really important for me going forward. And then in medical school, I started more concretely thinking about what a global health career would look like. And this was really where some of my interests and intersections of my different interests started to come to fruition. So I did a lot of work as a student around global health and digital education. I was a global health education fellow with the Stanford Digital Medical International Collaborative, known as Digital Medic. And I got the opportunity to lead a multidisciplinary team that was developing a digital anatomy curriculum for medical schools in India and Rwanda. Here you can see a photo on the top right of us filming, and then on the bottom left is just a snapshot from one of the videos that we created. And the premise here was that learning anatomy is, to learn anatomy well, it's really crucial to be able to get into the anatomy lab and dissect yourself or work off of previously dissected specimens called prosections, such as the ones that you see on this slide. But unfortunately, a lot of medical schools elsewhere in the world don't have access to anatomy labs due to, financial resources, staffing resources, having teachers that are trained in anatomy. There are a lot of gaps in that sort of training around the world. So the premise here was to be able to simulate a dissection lab experience virtually for medical schools that didn't have access to an actual dissection lab. So this then fueled some of the work that I did in residency. And as I will cover a little bit later in this talk, residency first and foremost is really where you get your clinical training. And that's where you learn what it's like to truly practice as a physician. But you also get the opportunity to do some research and some other scholarly activities if you choose to. So what I did was work with a team that was responsible for implementing and evaluating an electronic data capture tool, so a portable electronic health record, so to speak, in the Dominican Republic. We worked with a small clinic called Niños Primeros en Salud, and their community healthcare workers would go out into the community and launch these large deworming campaigns, which is where you go into the community and preemptively give therapies that prevent parasitic infections. And this was a really, really meaningful experience. I got to be part of the team in terms of co-designing the actual intervention, but first and foremost, my primary responsibility was actually designing the research study around how do we evaluate whether or not this tool was effective. And you can see a snapshot of what a very, very simple interface in this application looked like. As a resident, I also got to practice on the ground in Botswana, in Africa. So I worked at the Princess Marina Hospital in Gaborone, Botswana, which is the capital. And I worked on the pediatric medical ward as well as a little bit of time in clinic, but mostly I took care of children that were sick and admitted to the hospital. And this was a government hospital, but was affiliated with the University of Botswana. But what was striking was that even though this was the biggest center in Botswana and people came from all over the country here, it was still extremely under-resourced. I distinctly remember that before traveling, I was actually asked to bring a bag of basic supplies like medical tape and tegaderms, which are, dressings that we use for wounds, and basics like that. I went to, I was in residency at the time. So I went to one of the storage closets and I grabbed a ton of supplies and stuck them in a bag and I took it on a plane with me to Botswana. So this was a very, very formative experience, as you can imagine, for many reasons. And then briefly, I want to comment a little bit more on how art and creativity have played a role in medicine for me, beyond the performance arts. As a resident, I realized that it was, I had so little time, but it became increasingly clear that it was important for me to set aside some time for creative hobbies, just to keep that side of my brain working. So I took a month to be an intern in the ABC News medical unit, and for a while had been interested in, media and communication as a form of public health messaging. And this was an incredible experience. So I got to be, truly embedded in the team, involved with not just, the basics of fact checking and literature appraisal, but I got to write segments for Good Morning America. I wrote my own articles completely by myself, and that involved doing interviews, such as the one on, when should you be using your at-home COVID test when they first came out. So that was an article I got to write, which was an amazing experience. So this was really formative and showed me a lot about, as I brought up at the beginning of the presentation, that there are a lot of meaningful ways to contribute to healthcare for physicians and those who also choose not to become physicians. I've also had an interest in creative writing over the years. So as a resident, started writing for Synapses, which is a medical humanities blog, and that became a really wonderful way for me to process some of my thoughts and reflections around what it meant to be a physician and to also work with patients that are very sick at times, which can be very challenging. And that's something that I think a lot of people don't think about, is that, we can't fix all problems in medicine as much as we want to as doctors. So it's important to have a way to be able to process. So following residency, I spent some time at Harvard Health Tech, which is a program based in Harvard Medical School, and it's an innovation fellowship. And what it focused on was teaching a methodology called biodesign to healthcare providers, as well as scientists, engineers, those with a business background, really anyone that was interested in potentially working in the space between medicine and technology and developing health technology or med tech or biotech in some capacity. So this was also a really eye-opening experience for me. As I mentioned, I had started getting interested in the intersection between digital health and health equity, and particularly for the context of global health. So I wanted to gain some skills around what it meant to actually be able to design tools that were effective and needed. So this was a really incredible experience for that reason. That brings me to where I am now, so the present. So currently, clinically, I work at Stanford Children's Hospital in the Department of Pediatrics as a pediatric hospitalist. So what that means is that I see patients that are very sick and they're admitted to the hospital for a prolonged stay. So this is very different from what most of us think of when we think of our primary care pediatrician. I specifically work in the pediatric ICU, so that means taking care of children that are extremely sick, critical care, for those of you who are familiar with the term. And what I do is very rewarding and it's very, very cool. But at the same time, it also means that I work days, I work nights, and I work weekends. I often work shifts that are 12 to 15 hours and still have to do notes and do other work at the end of the day that's not done because it was too busy at the hospital to do it during the daytime. But I also get to do other cool things as an academic physician. And clinically, that means working with medical students and residents when they're in the hospital on the wards with us. So apart from being a clinician, I also get to spend a lot of time doing research as well as other scholarly activities that I care about as a faculty member with the various centers that I mentioned at the start of this talk. And the Center for Asian Health Research and Education in particular is one where I spend a lot of my time. A lot of the research that I do now is an intersection of a variety of the different skill sets that I brought up along the way. And I think it's an important learning point to remember that as you're going along, you don't necessarily always know how the threads are going to come together, and you can't do everything in 100% capacity forever. But that if you're thoughtful, there are ways to bring things together that you care about. So a lot of the research that I do now is large database outcomes-oriented research, which draws on EPI and health services skill set. But I also work with an NGO in India around co-designing and implementing diabetes prevention public health programs and running studies to evaluate whether or not those programs are effective. So that involves global public health, it involves a bit of social impact, and it involves implementation science as well. And then finally, I also get to continue to work with students in an educational capacity as an associate program director for the Care Scholars and Team Science Fellowships, which are research education programs that we run through the Center for Asian Health Research and Education. And then finally, I have to also spend a little bit of time commenting on the fact that, as I mentioned, creativity for me is really important, not just in my career, but also outside of my career. So alongside being an academic physician, one of my goals is to be able to develop a kind of a co-career, a parallel career in the arts. So I currently sing in Wobbly World as a vocalist, which is a world music band based in the Bay Area. And I also sing in the Stanford Symphonic Chorus. And while doing all of this does keep me extremely busy, what I found is that it's really energizing to have these other things going on in my life that I really care about. And it gives me the energy and the sustenance that I need to go back and be a good physician at the end of the day. So it's worth the time spent. So in terms of what that means for me in the future, while I'm still figuring out as someone who's early in my career, which is an important lesson that I also want to impart today, is that we're always all figuring it out.
Just now it started it's again. Sorry.
Oh, started muffling. See, can you hear me okay now?
Yeah.
Okay. So just, an important lesson I want to impart is that we're always all figuring it out. So what I know is that I care about seeing patients as a clinical physician. I care about health equity and global public health, and I also care about creativity and art. And I want to continue to find ways to integrate these themes both in my career as well as outside of it. Now that you've learned a little more about me and my experiences, I'd like to spend the next bit of our time together going through more generally what it actually takes to become a physician. And while I might draw on some of my personal experiences, this material is meant to be more of a high-level overview and more accessible to really anyone who's thinking about a career in medicine. So what does it take to become a physician? Well, the first thing you have to do in the US is 4 years of your undergraduate studies, so being a college student. And then, well, actually, before I move on, I think one thing I want to comment on here too is that historically, I think many of us have thought that it is, it's most useful to study something that will prepare you for medical school, like biology. But my advice to students and families now is, this is your opportunity to study something else that you enjoy learning, because you'll learn medicine in medical school. Studying biology in college doesn't necessarily actually really prepare you for medical school that much at all. So it's your opportunity to learn something you care about. But the other thing to think about too is it's, it doesn't have to just be for fun. What you learn in undergrad, whether you choose to be an engineer or a medical anthropologist or study health econ, these are other skill sets that you're building that you can then integrate into a medical career and make you unique as a physician and also give you value, especially if you decide to embark on a more non-traditional career path, so to speak. So after 4 years of college, you then do 4 years of medical school, although it is becoming increasingly common to do 5 years and obtain additional degrees during that time. And many medical schools have funding mechanisms to help you financially be able to do that, which was my case. And medical school is broken up into 2 chapters broadly. The first is the preclinical years, where it's more so, what we think of as traditional lecture material, textbook learning, and you do spend a little bit of time in the hospital learning about what it's like to see some patients as, well as, talk to a patient, how to examine a patient, some of those basics. And then you spend the latter half of medical school in your clinical years, so different from preclinical, and you're mostly embedded in the hospital and you rotate through different departments and different specialties and really get a sense of day-to-day what it's like to be a trainee and what it's like to be a physician in the long run. And based off that information, you make a decision about what specialty you would like to go into. And then you embark on 3 to 7 years of residency training. And in terms of the process to actually go to residency, you go through a process called the match, which I will actually save for a little later in this talk because someone asked a really good question about it as one of the pre-submitted questions. So I will circle back to that later. So once you match, you go to residency, and depending on the specialty that you pick, it can be anywhere from 3 to 7 years. And I really want to emphasize that residency and fellowship are some of the hardest chapters in medical training, but honestly in many people's lives. And I don't think it's something we talk about enough, and I try very hard not to sugarcoat it for students and families that ask me for advice. In residency, in most specialties, people are working anywhere between 60 to 80 hours a week on average. There are a few specialties where that's not the case, and that's also part of why people sometimes choose to do those specialties. But the vast majority of specialties, you work very, very hard during that time. You often work nights, you often work weekends. I had to do many 24-hour and 30-hour calls, which meant that I didn't sleep at all during that time and was on my feet in the hospital the entire time. I did that very, very regularly for 3 years in residency. And for some physicians, that also doesn't go away beyond training. They do less of it, but they still have to do it, especially if you work on the inpatient side in the hospital. So it's important to recognize what you're signing up for. The other piece that can be challenging about residency is that it falls in a time in life. For most people in their mid-late 20s is when they're starting, and for some in their 30s. So it falls in a time in life when often you're trying to settle a lot of other things, both professionally and personally. And you also see your peers in other career paths entering new chapters, like being able to afford buying a house, getting married. There are a lot of things like that we don't talk enough about, but I think it's important to recognize that this can be a very hard chapter. And that's why it's really important that if you choose to pursue a career in medicine, that you feel strongly about it. After residency, you do 1 to 3 years of fellowship. And so usually the longer residency programs have shorter fellowship training, and then the shorter residency programs have longer fellowship training. So on average, in total, it often ends up being about 6 to 7 years max of training if you choose to become a subspecialist. And fellowship, your life can also be very hard, but usually is at least a little bit improved from residency. And as I mentioned, it's becoming increasingly common to obtain additional degrees, whether that is the MPH, master's degree such as I did, the MBA, or the MD PhD. And at this point, once you've done all of this, you are a full-fledged physician. So the first 8 years is mostly spent being a student, and then the second 6 to 7 years is spent truly working in the hospital full-time, and that's where you gain your clinical skills and actually become a physician. So now I want to segue into talking about career paths within healthcare. So first, we'll focus on medical paths, so what it means to be a healthcare provider, and I will focus more on what it means to pursue the path to become a physician, but it is important to recognize that there are other ways to join medicine as a healthcare provider, whether that is as a dietitian, a physical therapist, a speech pathologist, a nurse, a PA, or a nurse practitioner. There are a respiratory therapist. There are lots of different ways to work in healthcare. But for our purposes today, since I'm speaking about my own experiences, I will focus on being a physician. So I really love this comic, and if we had more time, I'd love to go through it in more detail, but hopefully some of you have had a chance to at least read a couple of the little boxes. And I find this comic hilarious because it definitely simplifies what it means to be in any of these specialties down to a few very salient stereotypes, some of which have some pieces of truth. But I bring this up and I like it because it really conveys that different specialties are, good for different people. So again, being a doctor is not, there's not one way to be a doctor. And different people are suited to different things. So it's all about finding the right specialty for you. And for many people, there might be multiple right specialties. So then making a decision about, not just the specialty itself, but how it fits into the rest of your life and the other things that you care about. So briefly, this could be a whole talk in of itself, but there are a couple of different ways I break down specialty types. So one is thinking about surgical versus medical versus hybrid. So surgical is any field. Can you see my screen and you're still able to hear me?
Yes.
Okay, great. Perfect. What were you able to hear kind of mostly up till now, or should I backtrack a little bit?
No, I think you can continue from this point. I think you were on bullet number 2. So
yes. Okay, so I will get the presentation started. And yes, I was just rounding out bullet number 1. So there are fields that have an operating room component. So those are your surgical fields and surgical subspecialties. There are fields that don't involve the operating room, but are more quote unquote cerebral is how we refer to them. So fields like internal medicine and pediatrics, where they're more conceptual in nature as opposed to physically working with your hands in the OR. And then there are fields that are hybrid. And just to give you an example, interventional radiology or anesthesiology. So anesthesiologists are in the operating room. They're not hands-on working on the actual surgery, but they do a lot of important work in the background. And then there are patient-facing versus non-patient-facing specialties. So non-patient-facing specialties are those like radiology and pathology, where you don't see patients on the day-to-day, but again, do a lot of really important work in the background that makes the work that other fields do possible. There's inpatient versus outpatient. So inpatient means taking care of children, such as or adults, such as I do, that are admitted to the hospital for a prolonged stay. Outpatient is working in a clinic. So this is more the format that we think of when we go to our own doctor's appointments. So a physician sees a series of patients throughout the day. And inpatient versus outpatient have their own pros and cons. Inpatient, you're often working a lot of nights and weekends, but it's shift work. So once you're done, you're done. Versus outpatient, you mostly work days, maybe sometimes on the weekend, but you take a lot more work home in terms of being able to, you have to return patient phone calls. There's a lot more medical notes and charting involved. You have to fill prescriptions, do a lot more paperwork. So there's other complications there. And then work-life balance, although I put this in quotes because I'm not a big fan of the term, and I think this is a concept many people have heard before, that, work-life integration, I think, is a better term. But the different specialties afford people different luxuries, and different people have different needs. So that's also a big part of what goes into making a specialty decision. And then finally, I put in research emphasis, but more broadly, I think academic emphasis is what I really mean, because certain specialties might lend themselves well to other academic interests for those who know they're interested in staying in academia or having more of an MD plus type career. So for me, I obviously chose to become a pediatrician. So I will briefly talk through why I made that decision. And in the interest of time, I'm going to kind of go through some of the next slides and a little more quickly so we can have some more time saved for Q&A. And as Naren mentioned, I'm happy to stay over. So we'll definitely plan to run over so we can get through people's questions for those of you who are able to stay. So the reason I chose pediatrics was that I was interested in working with vulnerable populations and family units, and kids are one of the most vulnerable populations that we have. And the best thing is that if you get to help them, you are making a big difference for the rest of their lives. They are much more resilient than adults in many ways, and they have a lot of longevity ahead of them. And then finally, for me personally, as someone who is interested in this MD plus career model, pediatrics was a great platform for that as a field that is more generalist in nature. It lends itself well to issues around health equity and public and global health and policy, as well as media. So in terms of career paths within healthcare, there's the specialty piece, but there's also the piece around thinking about what setting you'd like to practice in. And there's kind of three big buckets I'll go through. The first is the community setting. Historically, that often meant private practice, although we are moving away from that. There are group practices and franchises. There are urban versus rural settings. And then community hospitals. So this could be, a county hospital in LA, which is very different from a Kaiser, but these are all, at the end of the day, community hospitals. Then there's academia, which, for the sake of time, as I've, already talked a lot about this already as someone who is in academia, but the punchline here is that if you want to become an academic physician, it's really important to think about and develop interests beyond your clinical skills, whether that is research. And research doesn't have to just be bench research. It could be public health. It could be clinical. There are a lot of different types of research out there. Maybe you want to do education work. Maybe you want to be someone who does medical humanities. So it's important to develop skills around those interests as well. And then finally, I have to bring up telehealth in this day and age where the role that technology is playing in healthcare is shifting quite rapidly. And then finally, there's global practice. So physicians that actually want to go live in a different country and work abroad. I also want to take a moment to talk about career paths within healthcare beyond medicine, so beyond being a healthcare provider. And this is actually probably the single most important piece of advice I can give any of you today, is that it's great to think about a career in healthcare as a provider. There are a lot of wonderful things about being a provider, but it's not the only way to be of service, and it is not the only way to contribute to healthcare. And it's also not the best fit for everyone. So it's very important to be realistic about that. There are a lot of sacrifices that go into becoming a doctor, and it's not the only way. So my advice is always to anybody, no matter how interested they are, especially young high school students and college students, to really think about all the things you enjoy doing. And if you're really convinced at the end of the day, after having experiences in those other areas, that there is nothing else that you can be doing or that you care to do, then go on and become a doctor. And the great thing is, if you have those other experiences and those other skill sets, they make you a more interesting doctor and a more valuable doctor at the end of the day as well. So, whether you choose to study engineering, there are people that go the health med biotech route. There are people who in interest in research. So we need people who are the PhDs. They're the ones that actually develop a lot of the therapies and the technologies that we use at the end of the day as physicians. Physicians are not usually the ones who are actually creating the solutions. We use the solutions. Going to public health or health policy, health economics, healthcare administration, these are all parts of what makes healthcare and makes the system work better. So we need smart people and hardworking people in all of these areas. And finally, science communication, which is a field a lot of people don't think about, but this could take the form of being an editor at an academic journal, but you could also be a medical journalist and work in media or be a filmmaker and do documentary filmmaking around medicine. And I know people who have done that. So there are a lot of different ways to contribute to healthcare beyond being a doctor or a healthcare provider in any capacity. Now, this slide, I will mostly skip in the interest of time, but mainly because it's redundant. So I referenced the MD plus concept several times at this point, but really it's a combination of the prior couple slides. So you can be a physician innovator and have your own startup. I know people who have done that. There are physicians that are also journalists, physicians that start out in academia and transition to working for a state public health department or working nationally in health policy. And sometimes it can be multiple of the above. It's just that it takes patience and diligence and thought into, the themes that you center your work around. And you might go through different chapters in life. You might not have it all at once, but when you average it out around on the long run, you got to do a lot of cool things. So pros and cons of a career in medicine, we've alluded to a lot of this as we've been going along, but just to reiterate, I think some of the biggest pros is that it is a career of service where there is a lot of one-on-one direct impact. It is a science and an art. It is a structured and safe path, which for some people isn't actually what they're looking for. So again, remember that one person's pro might be another person's con. And it is a field where there is more financial and job stability. In terms of the cons, it can have a very challenging work-life balance. Physician burnout is a very real problem that is continuing to grow. It's very easy to lose your hobbies and other things that you care about as a physician. There's a large administrative burden, especially in our healthcare system in this day and age in the US, which frankly is a very broken system. I spent a lot of time doing paperwork and doing administrative work and not actually thinking about medicine. It's a very long and rigid path and more of an operational career, so to speak, which again is a pro for some people, but for me was something I've always struggled with. And by that, I mean that it's a job where it's a little more rinse and repeat. So you go to work, you see your patients for the day, you go home, you go to work, and you do it again the next day. And for me, that's why it's been important to have research and other more kind of project-oriented work or more strategic work, so to speak, that I'm doing in parallel. And then finally, it can be difficult to achieve systems level impact, as being a physician is first and foremost a one-on-one direct impact, but it's not impossible. It just takes thought and it takes effort. In terms of the future of medicine, briefly, technology is very much becoming increasingly integrated into medicine. And I think the way medicine looks 10, 20 years from now will look very different, whether that is telehealth, the role of AI in medicine. I don't think what healthcare looks like today is how it will look even 5 years from now. There are also the shifting roles of healthcare providers, so nurse practitioners, physician assistants, CRNAs, so these advanced practitioners are increasingly taking on more clinical roles and increasing their scope of practice, which means that what it means to be a physician in charge of a team is going to look very different over the years, and something that's important to think about. There's a trend away from private practice to larger group practices. There's an increasing emphasis on value-based care, which in the interest of time, I'll skip the details on that, but it changes the way we reimburse and bill in the US, and can also change how physicians are compensated in the long run. I think there's also an increasing bridge between academia and the community as well as industry. And then finally, a growing contingent of physicians that are interested in being interdisciplinary, interested in pursuing the MD plus model. So to wrap with some reflections and lessons learned, there's more than one path. It's very important to align what you do with your values. Be afraid of the uncharted path, and related to that, push the box, do the things that you care about. And even if you pick a more rigid path, so to speak, like medicine, there are a lot of different ways you can bring you and what makes you into your career. Every career path has its pros and cons, and your responsibility is to figure out what's worth it to you. And then life and careers do not have to be static. There can be chapters and there can be change over time. And in fact, I would argue that that's one of the best ways to do it. And finally, make time and room for what energizes you, for the people you care about and the things you care about. And with that, I want to thank you all for being so patient and putting up with the technical challenges. I did save a couple slides at the end for Q&A. And I know that I'm sure some of you have additional questions beyond some of the questions here, but these are pre-submitted questions and there are some common themes amongst them. So for that reason, I will kind of briefly try to summarize my thoughts around these questions. So the first is describe your experience with the National Resident Matching Program, or NRMP. So this is
Nitya, could you go into full screen mode, please?
Oh, yes. Okay.
Thank you.
Yes, so describe your experience with the National Resident Matching Program. So for those of you who aren't familiar, it's a lottery system that dictates where medical students go for residency. So as a medical student, you apply to different programs, and then some programs will invite you to interview. You go and interview at those places, and then you make a rank list of the programs you're most interested in and what order that you'd like to go to them for. And the programs similarly make a rank list on their end of everybody that they've interviewed. And then there is an algorithm that figures out who goes where. And that means some people get their first choice and some people get their last choice, even if they're excellent candidates. I have friends that were at Stanford Medical School with me that matched into their top choice for highly competitive specialties. And then I had friends that, matched at the bottom of their list. And so there are a lot of factors that we can't always account for. It's not always a predictable process, and this can actually be a very stressful process for people. So as I mentioned, it happens at a time in life, mid to late 20s for people, where they often have other things that they're accounting for in their decision making, whether that is having a partner or getting married or being close to family. And it's not always possible to end up going to residency near where the people you are that you care about live. So I'm happy to answer more questions about that, but it is a very interesting process that in theory has a purpose, but I think can be very challenging and stressful for trainees going through it. For the next couple questions, I'm going to lump these together. Are there any measures in the works to have more humane working hours? Why is this not being fixed, given we know that there are high medical errors with sleep deprivation and fatigue? And then why are kids of physician parents reluctant to go into medicine? So the punchline is that, I do think things are changing. Training today looks better than what it did 20 years ago, but I think we have a long way to go. And sadly, there are people out there that are putting out research that says that the differences that we see in medical errors and patient outcomes is actually not that different, and that having residents work long hours allows for continuity of care. But the sad part is there is less research out there on physician well-being, and we need more of that. And the reality is, I'm not convinced that truly there aren't differences in medical errors or outcomes. I think there are. But I think for residency programs and hospitals, residents and fellows and trainees at the end of the day are, first and foremost, they're a way for them to staff the hospital. And I think that's what makes that chapter so hard in life, is that in theory, it is in part education, but in many ways, it really is, you really are, you are staffing for the hospital to cover their needs. And to be able to cover everything you need in a hospital as a hospital administrator, then you would need more residents and more fellows, which means you need to be able to have more financial resources to pay them. So that is a big part of the problem. And then finally, culturally, many physicians, especially those that are further in their career, who went through, residency maybe 20 years ago, have this mindset that, well, we had to do it, so everyone else who comes after us should have to do it too. Like, people are becoming soft. And I think that's a huge problem. I think that's starting to shift with my generation, but that is a big part of why things haven't yet changed. And this is why kids of physician parents, and I would add that kids also of kids that are younger siblings of older siblings that have gone through medicine, I've noticed often tend not to choose to go into medicine because they see, I think, all the sacrifice that goes into it and have had enough learned experience to understand what I was saying earlier in this presentation, that it's being a provider is not the only way to be of service and to contribute to healthcare. There are a lot of different ways to have a meaningful career that is of service to other people. So I think that's a big reason that many children who have family members in medicine choose not to go into medicine. A few more questions. So what is the differences in the path you've had to take for clinical versus research careers? So I will skip over this mainly because, I think I touched upon this a lot in my talk, but the punchline is you need a very different skill set if you want to do research in a meaningful capacity. To do a little bit of research on the side, like very, very small projects, you don't necessarily need a ton of extra skills, but if you want to do meaningful research, you definitely need extra skills and you need to be intentional about pursuing it. Best time to take the MCAT, I would say, there's not necessarily one best time. It just depends on whether or not you're thinking about going straight into medical school. So for those who are thinking about that, I would say the summer between your sophomore to junior year or sometime in your junior year is ideal. But obviously, the earlier you take it, the better, because it gives you the ability to take it again if you need to. For the next couple questions, I'm going to lump these together. So I'm currently in community college. Is it okay to get internships or research opportunities? What do medical schools want to see? And then, do you feel that med schools are searching for something unique? So absolutely, 100%. It is always okay and encouraged to get internships and research opportunities as much as possible. I think every student should always be doing everything they can in their ability to gain exposure and to network and make meaningful connections, and to also help yourself, figure out what you actually like and enjoy doing. And then in terms of our med school searching for something unique, I think they are. I think there are certain pieces that are common, like they do want to see, dedication to a career in healthcare. They want to see that you have a work ethic. And they tend to be drawn to applicants that are more, I think, multidisciplinary. So you have a lot of different interests that make you you. And then the irony is that it becomes hard to maintain those interests in healthcare as a career, and you have to figure out creatively how to do that. But I do think that is something that they're often looking for in undergraduate students. And I think that served me very well when I was applying to medical school. So with that, I appreciate everyone's time, and thank you for being here. I know we're, right just a little bit over, but I'm happy to stick around for actually for a while to answer anybody's questions that haven't already been answered in the course of this talk. And I will stop sharing my screen now,
Sure.
so that hope.
Thanks, Nitya. I think that was very interesting for everybody who was here on this call to understand what a physician's journey really is. We don't get to experience that when we go to a doctor or go to a hospital, but I think the people here are interested in exploring, if not deciding on pursuing the medical path. So I think there was a lot of information. I'd like to open it up for anybody that would like to ask a question interactively. And we can make it a discussion if you'd like to raise your hand, and then I can request you to unmute and come on camera if you want to. And let's use Nitya's time and your time more productively.
Hi, I want to thank Nitya so much because this is a discussion that we just had it last night with our family. Because my daughter wanted to get into medicine, but then she kind of was not sure about the long hours and if that's something she would really enjoy. I was exactly telling her that you don't really have to be a surgeon or a practitioner to really pursue medicine. There are so many alternative ways you can do that. So one thought that came to us is if she could be a medical consultant in a way, or be into healthcare consulting, if that makes sense. But we really don't understand fully what it means. Like, I have a very superficial idea of what it means. It would be nice if you can go over that.
Yeah, absolutely. And I'm so glad that you're having that conversation with your daughter because, as I mentioned, I think we don't have those conversations enough. A career in healthcare has a lot of sacrifice involved. So I think there are a lot of ways to contribute. To speak to healthcare consulting, that really can mean a lot of things. So, more traditional healthcare consulting is, what we think of when people might choose to go work at a big consulting firm, such as McKinsey or Bain or BCG. But a lot of the work that they do is focused on healthcare oriented projects. Um, and so what I've heard from people I know that work in healthcare consulting, that means they're often staffing projects, sometimes with big healthcare systems that are trying to, improve their kind of their increase their like quality improvement. There are people that work on projects with large pharmaceutical companies. But at the end of the day, having a healthcare consulting career of that type means that you're working more on the business side. So many people will do consulting for a few years and then maybe take that skill set and then go on to work in venture capital or health tech and whatnot. And then there's also healthcare consulting in a different capacity, which is more part-time consulting. And I know physicians who do this as well. So especially if they have a particular subspecialty expertise, they might then consult for a small startup, for instance, that is working on developing a therapeutic in cancer, just to give you an example. So there might be oncologists that do a little bit of part-time clinical healthcare consulting in that capacity as well. And then there are other physicians I know that consult for medical education companies and help them review the curriculums that they put together. So I think healthcare consulting still is, it's quite broad, but I think traditionally healthcare consulting refers to, one of those paths at one of the big consulting firms. I hope that answers the question.
Yes, it does. I'll be selfish and I'll ask you one last question.
Sure.
Yes. Is it necessary that she actually has to complete her residency if she gets an MD degree? Like if she's into a BSMD program, can she just get the MD degree and kind of use that for other things with a combination of economics and business to do
Yeah,
it?
so that's a great question. So I'm glad you brought that up. It is definitely not necessary to go to residency if you get a medical degree. That, of course, means that you can't practice. So I think that's the decision that students have to make is, do they care enough about clinical practice to keep it in their life? But this is more my personal take on it. As I mentioned, going through medical school, obviously residency fellowship is the hardest part, but medical school is also not benign, and also can be financially costly. So it's important to think about whether you really need the MD. Because my argument is that for physicians that end up doing other types of work in their career, the part of being a physician that makes them valuable is having the lived experience of having worked in a hospital as a resident or a fellow or an attending, or which is a full-fledged supervising doctor. Um, so for those who have gone through medical school, they have some understanding of healthcare, but the reality is they know very little about healthcare systems. Of what I knew as a graduating medical student versus what I know now are worlds apart, vastly different. I learned so much in the last few years as a practicing physician. So personally, my argument is that if you're thinking about not going to residency, it's probably better to actually just not spend the time doing medical school and go get the MBA instead if that's a skill set that you're interested in. I
Mhm.
think doing the MD is useful if truly you as a student you're not sure and you think you might want to go to residency but you're just not sure yet. So in that case you could try to do a joint degree, go to medical school programs that actually allow you flexibility to explore other interests. That was actually a big part of why I chose going to Stanford as a medical student, because not every medical school is supportive of having interdisciplinary interests. So I have many more thoughts on that topic, but I hope that's helpful.
Yeah, yeah. I did not get the last part. You said med school will let you explore other disciplines. Sorry, how does that work?
So certain medical schools are more supportive of students interested in doing interdisciplinary work. And so just to give you some examples from my personal experience, as a medical student at Stanford, I was able to get my master's degree fully paid for. by working some TA-ships, having some research assistantships. And I got a master's in epidemiology, but there were people that also got master's degrees in environmental science for instance, because they were interested in sort of the intersection between planetary health and nutrition and clinical practice. So that's a very niche example, but Stanford gave us resources to do those sorts of opportunities. They made it very easy to support additional research years where you could actually go completely, leave med school for a year and go work at a startup or go work in India for a year. I know people who did those things. So having those formative experiences as a medical student, especially if you're not sure yet, is extremely important.
Oh, that's great insight. I did not know about that. Thank you.
Absolutely. Yeah, absolutely. Not every medical school is supportive, though. So I think that's where the hard work goes into figuring out what environments will be supportive.
Got it. Understood. Thank you.
Of course.
Thank you, Nitya. There's a question from somebody who sent it privately. There's also a comment which says very comprehensive and inspirational. Thank you, Nitya. So that's just an observation from one of our attendees. The question is, will you provide some insights which may have helped you get admission at Stanford?
Yes, yeah, happy to do that. And it's funny because Naren and I were actually talking about this a couple of nights ago, but that really could be a whole talk in and of itself. And also getting into undergrad at Stanford versus medical school at Stanford are, also different beasts. For the purposes of this talk, I know this was a private question, so I'm going to make the assumption that we're wondering about how do we actually get into Stanford Medical School. And I think what served me really well, as I brought up at the end of the talk, was that I did a lot of things that other medical students, or pre-meds rather, were not doing. While I studied biology, so my degree wasn't necessarily that novel, so to speak. A lot of the activities that I did, how I spent my time outside of my coursework, they were activities that the students were doing. And I also put a lot of thought into what my values are. So why I wanted to pursue a career in medicine. And I think that is something that a lot of people don't always do. Because I distinctly remember when I was going through my medical school interviews, I'd written my personal statement about the story of my cousin in India, the one with special needs, and I shared a little bit about the arts collaborative that I designed around that when I was a college student. So that was one of the key experiences I talked about. And I thought a lot about what does it mean to be a patient? Why is it meaningful to interact with patients? Why do I care about direct one-on-one impact? And having stories and real life experiences to anchor those themes on, I think really made me a much more appealing candidate at the end of the day. And then, I think there are all the basics of just like being prepared. I think doing your legwork, knowing about different programs, thinking about, what you want your career to look like beyond just your clinical practice. And maybe you only want your clinical practice, and that's also okay. But I think having that higher level clarity as well is important to being successful in the med school admissions process.
There was an earlier question about Nitya, when you were reconnecting to Zoom, somebody had asked about me and Bitwise Academy. So I want to take a moment to just tell what we do. I'll share my screen to tell. I don't remember who it was that asked the question, but so we at Bitwise Academy, we are an online education academy focused on STEM education for students in grades K through 12. We've got, at a high level, we've got two sides of the academy. One is the e-learning platform that has got a lot of enrichment material that will help students primarily, middle and high school, but we also have some material for elementary school children, which answers the question about, so I learn all this math and science in school, what does that lead to? What can I do with it? So we give them the opportunity to, in a self-paced manner, to learn about what science and all the STEM that they're learning, how they can explore that in various application areas. And I'll send this information in more detail. We also have what we call as the Bitwise Live side, where we have people that interact with students, tutors, counselors, that interact with students. We offer tutoring. These are very academic courses, so you recognize most of these as being part of the Common Core and the NGSS and the AP College Board curriculum. So students that need help with all of these, so we've got a variety of tutoring that we do. That is briefly what, and me as a person with a background in tech and an interest in education, I'm part of Bitwise Academy, where we are passionate about helping students. And so today we are trying to address the topic of helping students and parents decide on the medical journey, which is why Nitya was gracious enough to come and talk to us about it. We're open for any other questions if people would like to ask or make a comment.
Sorry, Nitya, I have a question bank here. I have one last question.
No problem. You're asking great questions.
Thank you. I really appreciate this. It tells me about your service mind to spend your time and share your knowledge. You're super busy.
My pleasure. No, it's my pleasure. I'm really thrilled to be here.
Thank you. So one thought that we are going through is that if she gets an MD degree, that she would have more leverage over other candidates, like for anything that she might consider doing in the future, like she could be an ambassador for United States in the United Nations, right? Things like that. Or she could be in the space making, like on Netflix, competing with other people. And at that point, we feel like MD degree might distinguish her better. But again, I just want to see if that is even applicable or if it is even true.
Yeah, so I think my answer is very similar to what we were discussing earlier. So I think what I think at the end of the day, again, because it is just a time-intensive process and it can be a costly process, I think if someone is interested in interdisciplinary work, getting the MD mainly just to give yourself an edge, I personally don't think is worth it because it comes with a lot of costs. But if you're interested in being a physician who then does other interesting work, then absolutely it's worth it. And I would argue that the MD degree alone doesn't give you the competitive edge. Like on paper, to some degree, it might open some doors, but then when people actually ask you about healthcare, you don't really know that much sadly, unfortunately, at the end of medical school, you know a lot of textbook things, but you don't know a lot about healthcare. You know about healthcare after you've done your training. So I think to be able to actually have leverage and have a selling point that is unique to you, I would argue that it's better to go through the whole path than just stop with the MD. Or don't get the MD and go pursue the skills that you want to very rigorously in your primary career, or what you want to be your primary career.
Sorry, the last primary care part.
Yeah, I was saying that I would argue that it's better if you're not interested in clinical work to just not get the MD and go get the skills that you need to make your primary career. So yeah, it's better to just skip the MD and go get the skills you need to actually pursue the career that you want.
Got it. Thank you.
You're welcome.
There's another question here, which is, I'm a pre-med and I was wondering if you had any tips for finding activities that would set you apart when applying to medical school that isn't something most other people are doing.
That's a good question. I do have some concrete answers, but my real answer is that you have to do the hard work of figuring out what you care about. So I gave you lots of examples of what I've done in my life and my education, but other people wouldn't enjoy the things that I did. And likewise, I wouldn't enjoy the other things that other people did. So that's really the hard work, is figuring out what you care about. But it's a trial and error process. So I think the best thing to do is just, if something catches your eye as an undergraduate student, just explore it and pursue it. It's your time to be able to do that. It becomes harder to do that as you go along. But that being said, I think another way I can answer the question is to tell you the things that maybe lots of pre-meds do, so that you know that those are things that might be less valuable for you to do, because it won't set you apart. A lot of pre-meds will work in a basic science lab when it comes to doing research, which can be interesting for people. I did that myself before going to college. So I did it early enough that I didn't want to do basic science research, but I still was intrigued by the concept of research. Doing research that is that basic science can serve you in a lot of ways, because we don't actually have a lot of medical student applicants that are doing other types of research, whether that's medical anthropology or epidemiology. And we need more people who are doing other types of research. Like someone who has a background in health economics is immediately going to be a very interesting candidate, because not other people are doing that. So I think the major that you choose, the type of research you choose to do, because research is an important part of getting to medical school, but finding ways to do more unique. I think leadership is a really important piece that medical schools are looking for. So a lot of medical students or pre-meds will join whatever their pre-med association is. I would actually tell you not to do that. Don't join that. In my opinion, I would actually steer clear of joining some of the leadership committees around free clinics. While it can be meaningful work, unless you're really sure you want to do that kind of clinical work in the future, but a lot of pre-meds do that. So find other organizations that you're excited about, and it doesn't have to be related to medicine, but they allow you to take on a leadership capacity. So I spent a lot of time, I didn't get to talk about this, but in college I spent a lot of my time directing a leading classical dance team, as well as starting and directing an a cappella group in college. That took a lot of time, but it gave me some really fresh and vivid experiences to be able to speak to when I was going through my medical school interviews about what it means to, what I thought it meant to be a leader. So I think there's more I could say on that topic, but I hope that at least somewhat answers the question for
now. Thanks, Nitya. So just to summarize what you said, because the audio was having some issues. So I think what Nitya said is, don't just go by what Nitya has done or she's given examples of. See what it is that you would like to do, what excites you and what you find interesting, and pursue those. And Nitya, did you say that leadership is something, I heard the term leadership that you used. Is it something that you would recommend them doing?
Yes, definitely leadership and research, but doing research that is different from what other pre-meds are doing. Most pre-meds do lab research for bioscience. And then leadership, finding organizations that you care about uniquely. So don't just join the community association. Go find a group that you care about, and it doesn't have to be medicine oriented, but it should be a real leadership opportunity.
Nitya, there's another question coming up. Can I request that you mute your audio and we get on the phone so that, no, that may not actually work. Let me ask the question which is being posted, which is, do medical schools like it when you do research during third year or first year of college?
Medical schools like it if you do research in any capacity at any time. So I think the more research, the better, and it's never too early to start.
Okay, so the answer to that is that, I guess it is advisable to do more research when you're in college, because that's something that medical schools definitely take into consideration.
Absolutely. I would actually argue that it is a necessary part of being a successful applicant.
Nitya, not to put you on the spot, but I'm going to take this conversation forward and ask people if they have other questions or some clarifications that they can send them to me, and because I'll communicate back with everybody that's on this call. And if they have some other follow-up questions, is it okay if I send them to you for responses?
Yeah, absolutely. I'm happy to answer any questions that I can.
Okay, great. Thank you for offering that channel of communication with us. There's one other question that has come up. I know you can volunteer in hospitals for med school. However, do med schools value paid or volunteer positions?
So I don't actually think there's a huge distinction from a med school admissions committee perspective. I think it's more about, I think just how substantial and how meaningful your experience was. So how many hours did you clock? And then while you were there, what did you actually do? I think that the paid position is more valuable for you as a student. I think it's also important to have experiences where you know what it's like to be compensated for the work that you do. But at the end of the day, I think a lot of the volunteering positions in hospitals, truthfully, I think they don't set you apart, but I think that it's important exposure to have for a student who's thinking about a career in medicine.
I don't see any other questions in the chat. So with that, I'd like to wrap up this session. We will be in touch with all of the attendees here today. I'd like to take just a moment to thank Nitya for her time. You know, she has a very busy schedule, and I think this is her weekend time off that she had today that she offered to spend with us. And we at Bitwise Academy very thankful to her for it. We are also very thankful to all of you who registered that came to attend this. I know that these are questions that every parent and every student that's even considering the medical path has, and I hope this has been a very interesting session and informative as well. Thank you.
Well, thank you, Noreen, for inviting me, and thank you to the audience for being very engaged and for all your wonderful questions. So it was a pleasure to be here today.
Okay, bye-bye.